Hi, I wanted to begin a series of conversations with America about a subject that we don't normally like to talk about or even think about, and that is death and dying. And in America, I think we've developed kind of a skewed um, idea about death instead of an inevitable thing, um, uh, almost a peaceful process. It has become something that we fight against tooth and nail. And there's been this sense that there's something heroic or valiant about fighting death. And I think it has a lot to do with tabloids and some of the headlines we read as we wait in the supermarket aisles. And I think that started way back in about 1991 when Michael Landon, who was an American TV star, he was Little Joe Cartwright on Bonanza, the first color TV show that was very popular in America. And then he was on Little House on the Prairie, and he was kind of an American icon, and um, everybody loved him. And back in the days when we didn't have that many superstars. Anyway, he developed pancreatic cancer, and he determined that he was going to fight it. He was, if death was going to take him, he was going to go fighting. And he had chemotherapy, and I would imagine, spent a fairly miserable 4 months before he finally died. He was inoperable. There was nothing they could really do, but he was determined that he was going to attempt to fight this. And the headlines were full of this valiant fight for life. And, you know, people, since they respected him, I think that they respected that what he was doing. And through many years, I've been a nurse for 32 years, and I've seen a lot of death, and I've seen a lot of uh, dying that has been prolonged dying, that is very painful to watch. Um, and I've earned a perspective on life that I didn't have 20 years ago, 30 years ago. And I probably wouldn't have it all if I were not a nurse. Um, and I kind of want to share that perspective with you. And um, as an alternative to the Michael Landon story, I have another story of a friend. I worked, in this hospital, and he developed inoperable pancreatic cancer. And this was probably 15 years ago. And he decided that he was going to try to enjoy his last few months, however many few months he had left. And one of the things he wanted to do was he wanted to go to Europe. And I remember the hospital took up a collection for him, actually, so that he and his partner could go to Europe. And he was in and out of the hospital a few times in the subsequent months before he died. And he said that really the quality of his life was fairly decent. He would have stents put in, which are like little straws put in the ducts to keep them open so that you don't have as much pain. And he had a good few months before, it might have even been 6 months or more before he died. And I think that's a much more desirable outcome than to go kicking and fighting the whole way. Instead, there's more of an acceptance that, okay, it's going to happen, and I will get my life straight, you get my affairs in order, get my relationships straight, and that sort of thing. And in a way, the heroism, the people feel like it's almost bad to die, that it would be a bad thing to die. And in a very funny way, people who are dying almost need permission to die. I've seen that a couple of times personally, and so I would tell my patients who had family members who were approaching death, um, that it's something that you almost need to give them permission to die. I'll share two stories. One was my father was dying, and he was pretty much unresponsive. I think he would moan a little bit when we turned him, but other than that, he wasn't responding. And my mom and I were sitting at the bedside, basically doing the death watch. Um, and I went over and started stroking his head and talking to him and saying, Dad, you've done the good fight, but really it's okay. You can go now. You can go to your rest. And I kind of went on like that, and it was almost an instantaneous change in his breathing pattern. It was like an immediate relaxation, and within 3 or 4 minutes he died. And it was like we had been touching him, we had been stroking him, talking to him, but I kind of gave him permission to let go. And it was amazing to see that happened that quickly. Another story is I have another friend who's a nurse who had a grandmother that she was very, very close to, but the grandmother lived in Canada and she was in the United States. And so her extended family was with the grandmother, and the grandmother had been pretty much, again, unresponsive, comatose for several days. And my girlfriend called and said, would you please put the phone up to Grandma's ear? And she did the same thing that I did with my father, and told her grandmother that she lived a good life, and that they still loved her, but it was okay, that if she wanted to go to her rest, and that she didn't need to fight it anymore. And that was another case where, while she was on the phone, her grandmother died, even though the family had been with her for days, just kind of gathered around. She almost needed permission to die. And in our society, it's almost sad that we have this skewed opinion of life, because when you see death happen, it's a complete relaxation. A person can be struggling for breath. They can be in a lot of pain, and then there's this utter relaxation, and you can just tell, and it's not a bad thing. And I'd like to have a series of conversations about this subject, but I think that's enough for now, and I hope you have a thoughtful day. Thanks.